2018, my year with cancer. It all really starts at the back end of 2017 when I was first diagnosed. I had an appointment with a private specialist at the Saxon Clinic, Milton Keynes, on the 29th of September, to read some painful piles. And after he stuck his finger up my arse, he informed me there was a blockage in the bowel. He said he'd refer me to NHS for treatment as it would be cheaper than going private. That's when the alarm bells ring. Probably a bit more serious than piles if he's referring me to the NHS. Should hear more in a couple of weeks. At this time my weight is almost 13 stone. 5 days later my GP sends a referral letter to Milton Keynes Hospital for an urgent appointment within 2 weeks. A couple of days later, a call from the hospital for an appointment to see a specialist in 4 days. Hospital appointment with the usual finger up the bum. Told I need to make an appointment for some suppositories, a flexible sigmoidoscopy, that's a camera up the bum, and some scans. Following day I went up to Wales and took whiskey to stay with my friend Jan whilst I have all these tests. A few days later I left to go back home and the unknown, minus whiskey. Wednesday, 18th of October. I start taking a laxative supplied by the hospital. I later learned they call it dynamite, an appropriate name. The following day I had the sigmoidoscopy, painful, and they took some samples from some polyps to do a biopsy. Some lengthy interviews on the likely possibilities and then home. 3 days later, a CT scan. 3 days after that, an MRI scan. Thursday, 2nd of November, just under 5 weeks from the first finger of many to come, up my arse, an appointment at Milton Keynes Hospital to see the specialist on the 6th of November. Friday, 6th of November, I'm diagnosed with bowel cancer. I'm told the good news is it hasn't spread anywhere else yet, and an operation is set for December the 6th. But I've got cancer. When you hear those words, it's like a kick in the bollocks. Obviously, there's no nice way of telling you, and a talk with a sympathetic cancer nurse afterwards doesn't really make much difference. You've got cancer. How many people do you know that have got cancer? How many people do you know that have died of cancer? And to go with that, the surgeon casually mentions there was something with the bladder, but we can sort that later. Well, that's it then, I'm fucked. Something the nurse said to me after the diagnosis while we had our little chat in a side room was, "Are you scared?" Seemed a strange question to ask, I thought. "Not scared," I replied. "I just don't want to die just yet." The next day I drove up to Wales and saw Whiskey. I spoke with my friend and she said Whiskey can stay with her for as long as need be, whilst I have all this shit sorted out. A massive weight off my mind. I know Whiskey will be okay there, but Christ, I'll miss him terribly. He's all I've got and he means the world to me. A dog will always be by your side, no matter what. At this point in time, apart from a sore arse most of the time, my bowel movements are not the best either. Diarrhea and shitting blood a lot of the time. I'm also pissing blood and have been for a while. Saturday, 18th of November, I drive home back to Milton Keynes. Just over a week later, I have to go to the cardiology department at Milton Keynes Hospital for a dobutamine stress echocardiogram. Dobutamine is injected into a vein via catheter, which then makes the heart feel like it is under stress from exercise. The idea is to see if my heart would cope under anaesthetic during an operation. Because of my heart attack in 2010, my heart is not that strong. I lost 40% apparently. The results were not 100%, so I had to have an ECG. They decided I would have to have an angiogram in a couple of days to see if I need any more stents to boost the heart's blood flow. Tuesday, 28th of November. I had the angiogram, which showed 2 of my 3 stents were okay. One was a bit iffy. I think it might be okay, but a second opinion was needed, so it was decided I should go to Bedford Hospital for another angiogram in case I need any more stents. They can't do stents at Milton Keynes. Next day, back to the hospital for a pre-op check and a chat with an anaesthetist to be ready for the upcoming operation. Somehow, I don't think it'll happen because of the outcome of the second angiogram at Bedford. Friday, 8th of December, appointment at Bedford for angiogram. All went well, no more stents needed. However, this meant the operation was cancelled and had to be arranged for the 12th of December. The day before the operation, I'm told it's cancelled. Probably be in the new year now. A letter a few days later says operation will be the 24th of January 2018. Friday, 29th of December 2017. I drove up to Wales. It snowed. Saturday, 6th of January 2018, I drove back home to Milton Keynes. My weight at the start of the year, 12 stone 7¼ pounds. Wednesday, 24th of January, I arrive at the hospital ready for my bowel cancer operation. It's cancelled. It seems all my previous tests and scans are now out of date. Well, whose bloody fault is that, I wonder? They now want to look at my bladder. I now have bladder cancer too. Off to the urology department and the unknown. A bit nervous. I sit on the edge of the bed-type table and a quick explanation of what will happen. Yes, I'll be awake. No, I won't feel a thing. An injection into the base of my spine, and very soon my legs start to go numb. I'm helped to lay down and wait while the numbness takes over my legs and lower body. My legs are lifted up and put into some sort of stirrups to keep them up. The doctor's fiddling about down there, but I can't see what he's doing or even feel anything. Forget about your dignity. Cancer has a way of very quickly taking that away. A quick operation to remove the cancer, and then I'm off to a ward with a catheter down the old Jap's eye connected to a bag to piss in. 2 days later, the catheter's removed. Very painful, despite the young female nurse being as careful as she can. Now when I piss, it's like pissing fire and being kicked in the back. My piss is also the colour of blood. Very scary. Something I was totally unprepared for, and something I told the surgeons when they come and do their rounds. Why the fuck don't they tell people to expect some discomfort for a while? He listened, but I doubted it would make any difference. Something I would come to learn over the coming months. The surgeons may be brilliant at their jobs, but their bedside manner is non-existent. The nursing staff, however, are completely different. Brilliant at their jobs, sometimes taking some stick from awkward patients, but always giving a smile and some reassurance when you're scared or worried. Monday, 29th of January, I left the hospital. Into February and a lot of pain. Even the painkillers don't seem to help much, and I'm constipated. A nurse from the colorectal department at Milton Keynes Hospital rings to see how I'm doing. She was concerned that I was constipated and explains that I shouldn't really be taking codeine phosphate for the pain because it can make you constipated. Also, I should stop taking the Movicol for the constipation because that could cause my shit to push past the tumour and tear the bowel. Strange. Both of these medicines were given to me by the hospital while I was in there and when I left. Things like this really fill you with confidence. She also mentions that the bowel operation could be done at Oxford. Following day, an appointment at urology department. It seems my bladder cancer has spread to the wall or lining, meaning I will have to have the bladder removed. The dual operation to be done at Churchill Hospital, Oxford. I've also got a urine infection, so a course of antibiotics, and I have to drink plenty of water. A CT scan is arranged a few days later. I'm still pissing fire, and now blood clots come out of the urine too. Sometimes they're quite large, and I've still got blood in the urine. To add to all of this, when I piss, I feel the need to shit too. Sometimes a wet fart, sometimes a little blood. It makes going out very daunting. You never know if you'll shit yourself. I feel like I'm slowly being ground down. I just wish it would all end one way or the other. Maybe some light at the end of the tunnel, finally. An appointment at Churchill, Oxford, to see the bladder surgeon. He explains that they'll be taking over from Milton Keynes Hospital now, and all the work will be done at Oxford. A double operation will be performed to remove the bladder, prostate and the tumour in the bowel. A high-risk operation, a big operation. Now, all these hospital appointments are quite costly in terms of travelling. The Milton Keynes appointments I get a taxi to. Saves the bother of trying to park. Plus, you never know if you'll be able to drive afterwards anyway. About a tenner for a round trip. For Oxford appointments, I use NHS transport, which if you meet the requirements and qualify, it's free. Sometimes it's a private local volunteer driver using their own car. They get fuel expenses. Or sometimes one of the larger NHS ambulance type vans driven by NHS staff. As February marched on, I continued to have an iffy stomach. Quite unsettling when on a long journey to Oxford, so as well as painkillers, I was now taking stuff to stop me shitting myself. The 1st of March, and because of snow, my appointment at Churchill Hospital to see the stoma nurse is cancelled. An appointment at John Radcliffe Hospital, Oxford on the 5th is also cancelled. No idea why. 7th of March, and I had an appointment at Churchill Hospital for a heart test on an exercise bike. Sitting on a bike, pedalling whilst having a tumour up your arse is quite painful. Apparently they deduced from all this that I have an irregular heartbeat. Did I know? No. From there, down the corridor for a pre-op assessment. Must mean the operation is imminent. Back home and still have an upset stomach and a very sore arse. 5 days later, an appointment to see the bowel surgeon at Horton Hospital, Oxford. A few questions, finger up the bum, again, and then I'm asked, have I had an MRI scan for the liver? Fuck knows. Some more delays. There may be something with the liver, there might not. Either way, they need to do the operation soon. Yeah, sooner rather than later, please. Then home. All these appointments start to take their toll. I've not been feeling that good anyway, what with painful pissing, a dodgy stomach, a sore arse. I had been going back to bed in the afternoons to take the pressure off my arse. Hardly a quality of life. I just wish they'd get on with it. Back to Churchill Hospital about 10 days later for an appointment with a stoma nurse. I explained that all this waiting and delays are very stressful. I've lost nearly a stone in weight so far this year, and at this rate, by the time they get round to doing an operation, there'll be nothing left of me to operate on. A few letters waiting when I get home for more appointments. PET CT scan and MRI scan. PET TC scan on the 23rd cancelled because the hospital transport turned up late. PET CT scan rebooked for the 27th. Cancelled again because the hospital transport didn't turn up. This is all very stressful. It's bad enough having cancer without all this fucking about. My GP arranges for me to see a Macmillan nurse at Milton Keynes Hospital. It was good to get a few things off my chest, and she was appalled how long Things have been taken, but that's it. No magic wand to wave, unfortunately. We're now in April the 4th, Wednesday, an admission to theatre at Churchill Hospital for a stoma operation. This means I'll be shitting in a bag and hopefully get some sort of life back whilst waiting for the main cancer operation. This has come about because I'd complained about all the delays, the stress it was causing, and if they didn't do something soon, I would. Roughly a 2-hour operation. Back in the ward, I'm on painkillers, morphine, and I've got another catheter up the Jap's eye. Stoma is done, and I have a colostomy bag to shit in. No solid stuff yet though, just a brown liquid. At the moment the bag changing is sorted by the stoma nurses, but it's something I will have to master myself later. Things are very painful though, thank goodness for morphine. They like to get you out of bed for a little while each day and a short walk, but I'm really struggling, it's just too painful. After a few days I managed some short walks. They keep telling me they're pleased with my progress. Doesn't feel very much like progress to me. 4 days later the catheter is removed very carefully by a young nurse and not so painful as before. So now I piss in a bottle as I can't leap out of bed to go to the toilet just yet, but they like to monitor how much urine you're passing. I'm getting in and out of bed a bit though, but very slowly. Started to have anti-blood clotting injections too. Not good with needles and injections. They tell me they will arrange for a nurse to visit my home to give them to me. I'd be a useless drug addict. Monday, 9th of April. I'm told they won't send me home until they're satisfied that I can change my bag on my own. Midday, I'm wheeled off for an MRI scan and then a CT PET scan. Back in the ward just after 4 p.m, feeling very tired and battered. Slept well. In the morning, when I go for a piss, there's some blood at first and quite painful. Shitting in the bag, there is nothing solid yet, just a runny brown liquid. A couple of days later, I managed to change a bag on my own. I feel like I'm getting pressure into going home soon though, despite me telling them I'm not confident yet changing the bags. Things came to a bit of a head over the weekend. Some of the doctors saying I'm ready to go home, me saying I've only changed a couple of bags. Fuck it, I'll go home on Monday. I'll pack my bag. Bleeding from my arse a bit. Told this is quite normal. Be okay in a few days. Finally got to go home Monday, 16th of April. A nurse turns up next day to give me my injection. Grumpy cow. Says I'll have to do these myself soon. A couple of different nurses come over the next couple of days and then they stop coming. I try a couple of times to do it myself, but when I caused my leg to bleed, I decided, fuck it, no more, I'll take my chances. Appointment at Milton Keynes Hospital to see a specialist who explains about chemo and radiotherapy they want me to have at Oxford soon. A pre-op appointment is arranged for Monday at Churchill Hospital. My arse is still bleeding, but I keep being told whenever I mention it that it's quite normal, it will stop soon. I wish it would. Monday, 23rd of April. Was told about the chemo and radio sessions to begun at Churchill Hospital, the potential side effects, and it will be for 5 weeks, Monday to Friday. Radiotherapy takes about 10 to 15 minutes, painless, and then I'm took home. The chemo I take as tablets, twice a day at home. Nothing at weekends, and then do it all again on the Monday. That's the next month sorted then. After the interviews, I'm taken to have a CT scan and some blood tests. Then home. Whilst all this cancer stuff is going on, my GP has recommended that I have a course of vitamin B12 injections. I'm also on iron tablets 3 times a day. At times I get the feeling that my body's saying, fuck it, I've had enough. Still bleeding from my arse, very uncomfortable to sit for too long, and even when I lay down. Tuesday, May the 1st. Got a letter for what appears to be a duplicate MRI scan at Milton Keynes Hospital in a few days. I already have one booked at Churchill Hospital for the same day, along with the other appointment. So I cancelled the Milton Keynes scan. Seems to me the two hospitals don't liaise with each other very well at times, and I'm left in the middle to sort things out. I feel very tired, no energy, and bleeding from the arse still. My stoma bags are getting in short supply, and I seem to be having trouble getting some more. Monday, 7th of May. Start my 5 weeks of chemo and radiotherapy at Churchill Hospital. Up at 4:30 a.m. to be ready for when the lift arrives. On the road by about 7, along with 3 other people going for the same treatment. At the hospital about 9 a.m. See the nurse for a bag of medicines and then wait for my turn for radiotherapy. When we are done, we head back home. Finally home about 1 p.m. Seems like a long day. Very tired. On the Wednesday of treatment, I was due to have an MRI pelvis rectum scan. Guess what? The scan was cancelled. During May, I'm having to change my bag up to 3 times a day, sometimes more. My stomach seems very unsettled and still bleeding from my arse. I've now got earache. Quality of life seems non-existent. Most of the appointments are in the mornings, but the Friday ones are in the afternoons. Not good because having to have a blood test done every Friday, which can sometimes delay things. Also, Friday afternoon traffic can be a real bastard. One Friday we didn't get home until 8:10. Hell of a long day. Into June and the last bit of chemo and radio. Weight is at 11 stone 9 pound. Still bleeding from my arse. Mentioned it to one of the doctors at Churchill Hospital whilst having a treatment, and I'm told sometimes the radiotherapy can cause it. Might get a bit worse over the next few days, but then it should settle down. I wish. Sunday, 10th of June. Treatment is over, so I decide to go to Wales for a while. I need a break from all this. Still bleeding from my arse, and my stoma seems to be sticking out quite a bit. A hernia, I think. After a week, I head back home to Milton Keynes. Wednesday, 20th of June. An appointment with a stoma nurse at Milton Keynes Hospital. She confirms that I have a hernia, doesn't seem too concerned, and orders me a support belt to wear. A couple of days later, I go back up to Wales. Arse bleeding seems to have stopped now, mainly mucus. Back home to Milton Keynes beginning of July. The support belt seems to be helping. Stoma doesn't seem to be sticking out so much, but the belt makes my back ache. Tuesday, 10th of July. I get a phone call from Churchill Hospital. Operation date is 8th of August. Finally. An appointment 2 days later with a specialist at Milton Keynes Hospital to explain what the operation would entail. Probably a couple of months recovery time, then about 3 or 4 weeks after some chemo, tablets or injections. He also said he would organise an MRI scan in a couple of weeks' time. A week later, an appointment with a bowel surgeon at Churchill Hospital. He talks me through the operation. It will be for about 8 hours. They'll remove the bowel tumour, the bladder, prostate, and maybe the anus. Be in hospital for about 2 weeks, and then about 6 months to recover. I get back home and travel up to Wales. This could be my last visit here for some time, or ever, if things go tits up during the operation. Good to be there for a few days and see whiskey. A week later I drive home. Tuesday, 24th of July, a pre-op appointment at Churchill Hospital. Loads of questions to answer, bag full of various medicines, and then an ECG and a blood test. Got home in the afternoon and then a phone call regarding my stoma bags. A delay again. Getting pissed off with this. Next day I had a CT scan at Milton Keynes Hospital. 3 days later I get some stoma supplies. Less than I ordered though. It seems my GP intervened. When I ordered direct from the supplier, it has to be authorised by my GP. And because I'd ordered 3 boxes, because I'm having to change the bags so often, she decided I didn't need that many for a month. Fuck's sake, I'm the one that needs them. I'm the one with cancer, and I know what stuff I need. Why can't people listen to what I say instead of thinking for me? It's not like I wanted to flog them on eBay or at the local car boot. Wednesday, 1st of August, MRI scan at Milton Keynes Hospital. Operation date seems forever to arrive. Sadly, my NHS transport didn't. Someone at the hospital decided to cancel it and not tell me. Fucking great. The most important appointment of this cancer saga, the operation itself, and my travel plans are fucked up by someone who decides the hospital will not authorise payment. Thanks, Sue. Panic. What to do? I ring a local cab company and ask can they get me to Churchill Hospital as soon as possible. Cab turns up in about 10 minutes. My admission appointment was for 7 a.m. It's now 7:15 as we leave. I explain to the cab driver what's happened and he says, I'll get you there as quickly as possible. He does. Top bloke. On the way there, I frantically ring the hospital to explain what is happening and that I'll be late. Told not to worry, just get there as soon as possible. Finally arrive a bit late, but get booked in to Ward 11. After a 5.5 hour operation, I wake up in an intensive care ward, very tired and very sore. The next day they tried to get me up for a walk. No way, much too painful. Friday, 10th of August, after a lot of painkillers, I finally manage a short walk. This is the worst pain I have ever experienced. Later they take me down to a ward. It's the same ward I was in April for my stoma operation, and a lot of the nurses remember me from then. Various painkillers through the day and morphine on tap. I press a button and I get a shot every 5 minutes if I need it. I need it. Lost my appetite and food tastes awful. I think it's all the painkillers that I'm on. The next couple of days I try some short walks down the corridor on the arm of a nurse or a physio. Getting me mobile seems to be a priority. I now have a different type of colostomy bag. This one I shit in as before, but because I no longer have a bladder, I also piss in it too. Thankfully, at the moment, the nurses changed the bag at the moment, and at night I'm connected up to a bigger bag for when you're sleeping. The thing is, you no longer when you will piss or shit. It just happens. Over the next few days, the pain doesn't seem to be getting any better. Neither does my walking, but I persevere with it. One of the specialists come in one day to check on me. Seems pleased with my progress. He says I should feel less pain in about a week, and it might take about a year before I get back to normal. And when I leave the hospital, no driving for a couple of months. The days roll on, still in pain and very tired. Short naps through the days in between having painkillers and blood pressure checks. By the 17th, I'm still not eating much, still in pain, but managing a couple of short walks each day. Having frequent blood tests, various painkillers, and still having morphine. I'm told I should be walking a bit more than I am. I told them I would if I wasn't in so much pain. A couple of days later, they send me off for a CT scan to try and find out why I'm in so much pain. Result of the scan was that I'm constipated, so now I'm on a laxative to make me shit more. Thursday, 23rd of August. One of the doctors is putting quite a bit of pressure on getting me home. I explained to him that I haven't even changed the bag myself yet. How the hell am I supposed to go back home? Most mornings now I wake up feeling sick, so I'm now on anti-sickness tablets along with everything else. A couple of days later they weigh me, 10 stone 13. Seems I've lost about 10 pounds since June. Tuesday, 28th of August. I changed my bag for the first time. I'm also getting a discharge of mucus and some blood from my arse. Mention it to the doctors when they come round in the mornings. Nothing happens though. Into September, and finally something is going to be done about my leaky bum. They arranged for a CT scan to see what the problem is. Maybe it can be treated with antibiotics or else a small operation to try and drain it off. After the scan, they decide it's a build-up of pus, which can be treated with antibiotics. Should clear up in about a week. The next day, they decide to operate instead. I'm told it's a bit risky, but they'll try to flush it all out. Had to sign the consent forms, and the doctor explains roughly what it all entails. Wednesday, 5th of September. I'm wheeled off to the theatre about 10 a.m. for the operation. Only takes about an hour. I wake up in recovery ward, and after a while I'm taken back to my ward by 2 p.m. No one has told me anything yet, but I have a plastic tube up my arse which is draining stuff out into a bag. So was it all successful? No idea. Nobody's told me anything. Finally, at 7:30 p.m. a doctor comes in and explains everything went well. The tube is to drain off any excess pus and should be able to come out in a couple of days. Monday, 10th of September. The tube is finally taken out of my bum and I'm told I can go home tomorrow. Great. Tuesday, 11th of September. Home. Thursday, 13th of September. Appointment at Milton Keynes Hospital with an oncologist. He tells me the operation went well. The bowel cancer was a nasty one, but they think they got it all. However, I have to have 6 months of chemo just to make sure. Probably start in October. Tuesday, 18th of September. John Redcliffe Hospital appointment with bowel surgeon. He seemed pleased with the way things went with the operation, but said there were still some cancerous cells in the anus area, but he didn't seem too concerned at the moment. Well, he wouldn't be concerned, would he? It's not his arse with cancer. My blood count is low, apparently, and I'm anemic. I get the feeling I'm slowly falling apart. Home about 6:30 p.m. Friday, 21st of September, I get a home visit from someone from Milton Keynes Occupational Therapy. She explains that there are some things they can do to make things a bit easier for me. Sounds helpful. She then mentions that of course it is means tested. That's it then, nothing. When my mum died, she left me some money in her will, so I'm too wealthy according to them now. I'm on my own. Tuesday, 25th of September, appointment at Churchill Hospital to see the bladder surgeon. He tells me I'm doing well. Home just before 6 p.m. It's a shame some of these appointments can't be done together on the same days. Friday, 28th of September, appointment at Milton Keynes Hospital to see the oncologist. He explains the procedures for chemotherapy. They want to start it on Monday, 15th of October. Could be for 3 or 4 hours, then chemo tablets for 2 weeks that I take at home, then a week off with nothing, then start the cycle over again the following week. Next day, I'm back at Milton Keynes Hospital for a CT scan. Sunday, 30th of September, I decide to go to Wales. I really need a break from all this, and I desperately want to see my boy Whiskey. I leave about 5 a.m. and arrive just after 9 a.m. All the dogs were really pleased to see me, including Whisky. There's something about the love of a dog that can bring a tear to your eyes. They never forget you and always want to love you no matter when they last saw you. Give me a dog over people any day, even family, especially mine. Left for Milton Keynes on Thursday the 11th of October to prepare myself for the upcoming chemo treatment. Monday, 15th of October, the big day arrives, chemo day. My first session. After about an hour and a half, my arm with the poison going into it begins to feel like it's on fire. I asked the nurse, is this normal? She says she'll slow it down a bit. Instead of a 2-hour session, it's now about 4 hours. Arm is still burning. Tender to touch, and also my hand and wrist. I have to take my watch off. It's becoming unbearable. Finally, it's over and time for the taxi ride home. I'm told to keep out of the cold, wear a scarf over my mouth if I go outside. If I have to get anything from the fridge, wear some gloves. My fingers could get tingly, and my arm is feeling useless. I can hardly move it and it hurts like hell. So much for chemotherapy. I'm not sure I can take 6 months of this. Next day my arm still hurts like hell and it's difficult to move. This makes changing my stoma bag very difficult, trying to do it one-handed. As soon as my fingers meet something cold, they begin to tingle like mad. Even taking cutlery out of the kitchen drawer sets it off because it's cool to the touch. Door handles too. After a few days of this, I decided to stop taking the chemo tablets. No point in adding fuel to the fire. I'll have a couple of days of very bad diarrhoea. After about 16 days, the tingling in the fingers wears off. Thursday, 25th of October, an appointment with the oncologist at Milton Keynes. I tell him to forget about any more chemo. I explain how I've been, but he says, I'd rather you didn't stop. Okay, I ask him outright. You say after the operation all the cancer is gone. If I don't have the chemo, what are my chances? He tells me 30% chance it could come back in 5 years' time. And if I have the chemo, I ask? 60% chance we can stop it recurring in 5 years. I think for a moment. So even with the chemo, there's still 30% chance it'll come back in 5 years. Not very good odds, is it? What if I reduce the dose a bit, he says. I think about it briefly, then say, okay, I'll give it another go. Monday, 12th of November. I start second session of chemo. Same as last time. Arm feels like it's on fire. 4 hours I put up with it. I find out the dose has not been reduced like I was told. Bastard. I get home and decide no more chemo. I'll take my chances. 17 days I feel out of action with my fingers. Difficult to even cook. The next few days I develop a really bad cold. I can hardly walk around the house. I feel dizzy, really cold. I feel like shit. Arse is still leaking, pus and blood, and on top of all this, there is some delay in getting the stoma supplies I need. If I was a dog, I'd be put down. Had an appointment at Milton Keynes Hospital with the oncologist, but I cancelled it. I feel too rough to go out. He rings me back later in the day and I tell him what's been happening and I'm going to stop the chemo treatment. He asks how I'm coping. Not very well. He asks if I would like to go in hospital. No. A bit later in the day, my GP rings me to see how I am. Apparently the oncologist rang her because he was a bit concerned. We have a talk and then she tells me if I want to stop the chemo, then stop it. My decision, and not to let anyone force me into doing something I don't want to do. Monday, 26th of November. The district nurse comes round to see me, takes temperature, blood pressure, etc. and says everything seems fine. It's all probably part of the side effects of the chemo. 3 days later, I have an appointment with the oncologist at Milton Keynes Hospital. I struggle to get there. I'm determined to tell him I'm not doing the chemo anymore. There's a bit of a wait because they're running behind, so in the meantime they take my temperature and blood pressure. Temperature is 38 degrees, high. Blood pressure is very low. I wait in a waiting room to see the doctor. I tell him I'm not continuing with the chemo. He seems more concerned about my temperature and blood pressure, so I'm wheeled down in a wheelchair to a room with a bed and put on a drip for about 4 hours. My vitals are taken every hour and I start to recover. Blood test, then I'm allowed home. Tuesday, 11th of December, an appointment at Churchill Hospital to see the urologist. Explained about my arse constantly bleeding and pus, and I'm getting increasingly fed up with everything. He puts his finger up me bum himself, just to see. He tells me that the bowel surgeon who did the operation is leaving the department, but he will speak with another surgeon to take over my care. Then home. One of the interesting things that happen throughout all this are the copy of letters they send you. Copy of the letters they send you that have been going to other surgeons and also your GP to update them on progress. You can learn a lot from these. Naturally, it's all in the language they understand, but with the help of Google to translate it into layman's terms, I've learnt a lot more, and their opinions of you. Recommendations for community help, which I've never had, how they perceive how you're coping, and even at times I'm clinically depressed. And that's where we are at the moment. My weight is 10 stone 9, possibly some more radiotherapy to investigate these nasty little cancer cells that have reappeared. Another possible operation on the anus to remove them and close it all off. My arse still bleeds pus and blood on a daily basis and is very sore. And I'm on antidepressants, which don't seem to be working. Let's hope 2019 is a better year. It can't be any fucking worse.